In all seriousness, thank you very much for holding this series of really important hearings on what is a public health crisis and also a crisis for families all across this country. As Governor Brown pointed out, there's no place that is immune. Governor Hogan, I want to start with you. This month, as we've been tallying up the numbers from 2017, we've been hit by a series of heartbreaking statistics. Just a few weeks ago, we learned that last year, drug overdoses killed a record 418 people in the state of Maine. That's an 11% increase. So we're going in the wrong direction. Then this week, the CDC announced that in Maine, emergency visits for opioid overdoses jumped by 34% last year. In the past 3 years, the number of people in Maine who died by drug overdoses has doubled. And at the same time, we at the federal level have increased funding and federal efforts year after year to combat this crisis. So my question to you is, what are we not doing right? You talked about the multi-pronged approach that I totally agree with, of education, prevention, treatment, and enforcement. We, due to the leadership of this committee, have poured a lot of money into all four of those categories. So what is it that we're not doing right?
Well, Senator Collins, thank you. We ask ourselves that same question nearly every day. I mentioned in my testimony at the beginning that we were sort of ahead of the curve on focusing on this issue going back to 2014. And we immediately took every action that anyone could think of from every direction, and we put $500 million into it in our little state, in state money. And then we created the first state of emergency where we stood up our emergency operations center to coordinate every single state and federal and local agency to provide real-time assistance on all these different directions. And as I said, we made slight improvements in prescription opioids and in heroin, but because of these new synthetics, fentanyl and carfentanil, we still had more people die. And we had nearly 2,000 people die in our state, and a 70% spike in this new drug that no one knew anything about. I mentioned a few things, but I think more coordination and more cooperation from the federal government with the state and local, so we all are, knowing what can we each do to collectively to make this happen. And I think we do need more federal funding with some flexibility for each state, how they can utilize these funds depending on how the issue is shifting and where they are at that point. In talking with Governor Brown, fentanyl is not yet, I guess, a big issue in Oregon, but I believe it will be. Other things are starting on the West Coast and coming out to us. I talked to other governors. We had all the nation's governors together last week at NGA, and there were people talking about, crystal meth is now reviving in their states, and they're lacing that with fentanyl. They don't even have opioids and heroin. But I think it's going to take all of us working together. You're right, the federal government and your committee's been on top of this issue, and it's been a focus, and I know that there was a task force put together with a lot of smart people with lots of recommendations. But it's going to need federal funding. I think the STOP Act on fentanyl, so we can interdict, is important. The Opioid Response Enhancement Act, Comprehensive Addiction and Recovery Act, the CARA, Synthetic Trafficking and Overdose Prevention Act. I mean, there are many good pieces of legislation in the House and the Senate that should be passed, and they're coming from both sides of the aisle in both houses, and they all ought to be considered because we've got to look at this thing from every direction.
Thank you. My time has nearly expired, so Governor Brown, I will submit a question to you for the record, but just so you know what it's going to be about, you mentioned that life-saving drugs such as naloxone have seen exorbitant price increases in the past 3 years, in some cases as much as 487%. And for the record, I'm going to ask you a bit to explain what your state is doing to try to combat those huge price increases, which limit the availability to first responders. Thank you, Mr. Chairman.
Thank you, Senator Collins. Senator